PAEDS OSPE 2026 31st March to 22 April final year MBBS. Just take screenshot and revise. PAEDS OSPE morning. All the clinicals: hypothyroidism, chickenpox, meningitis, metabolic acidosis, Down syndrome, nasogastric tube, nephrotic syndrome, hypokalemia, management, abdominal exam, and GPE. Evening OSPE PAEDS, Gower sign condition which it is positive, inheritance pattern, AV block, chest tube, complications, use embo bag, steps of neonatal resuscitation, ascaris, lumbricitis, varicella, stone in renal area, respiratory distress, very vague substandard picture it was. Next is a morning OSPE PAEDS, X-ray finding and differential diagnosis. Just take screenshot and revise all. X-ray finding, phototherapy, brain abscess, congenital hypothyroidism, duodenal atresia, ITP, tetanus neonatorum. Just take screenshot and revise. Thus PAEDS OSPE morning, tetanus neonatorum finding, prevention of diagnosis, brain abscess, disease management, and X-ray. Just take screenshot and revise. Morning OSPE PAEDS. This is X-ray finding, disease, phototherapy unit, brain abscess, congenital hypothyroidism, duodenal atresia, ITP. Next is PAEDS OSPE morning, tetanus neonatorum finding, prevention, diagnosis, brain abscess, disease management, X-ray finding, hyperlucent lung, flattening of left diaphragm, disease, emphysema, congenital hypothyroidism, duodenal atresia, syndrome associated by hot spots management. Evening OSPE PAEDS 1st April 2026. ITP scenario, pneumothorax X-ray, lumbar puncture needle, celiac disease scenario, marasmus child picture, UTI scenario, subdural hematoma, and next is just take screenshot and revise. Indirect fever, this is same scenario, lumbar puncture needle, celiac disease, marasmus child, UTI scenario, subdural hematoma, indirect fever disease. Next is PAEDS OSPE morning OSPE session. Hydropneumothorax, bite hot spots, prevention, erythema nodosum, hydrocephalus syndrome associated treatment, acute gastroenteritis, phototherapy unit, central cyanosis investigation, UTI posterior urethral valve investigation. Next station is just take screenshot and revise. OSPE station PAEDS evening 2nd April. Here on end thalassemia, IV granula, cough hypertrophy picture in Duchenne muscular dystrophy, Apgar score, pneumothorax, tetanus neonatorum, DKA, marasmus. Just take screenshot and revise. Evening OSPE PAEDS. This is congenital hypothyroidism, Erb's palsy, clubbing, ascites, laryngoscope, and ETT. Apgar score, bag and mask ventilation, indirect fever, TB, chest X-ray. Just take screenshot and revise. PAEDS morning OSPE 4th April, hemolytic disease of newborn, TOF, rickets, chest picture, pyogenic meningitis, tuberculoma, brain abscess, acute watery diarrhea, lobar pneumonia, X-ray, and last is pulse oximetry. Next is just take screenshot and revise. Last is evening PAEDS station 1, von Willebrand disease to identify Station 2 was on embo bag and identification, 100% oxygen. Station 3 measles. Station 4 hydropneumothorax. Station 5 hydrocephalus. Station 6 lactose intolerance scenario. Station on UTI, investigate, confirm, treat it. Station 8 was supina bifida and its types and prevention and pregnancy.